What if I told you that the coronavirus is not the last pandemic that can wreak havoc in the world? Does it scare you that the next pandemic that could turn all our lives upside down might be much closer than we think? The World Health Organization has a list of priority diseases that could potentially be the next coronavirus. Disease X is the latest addition after Ebola, SARS, and the Zika virus. So what is Disease X? According to the WHO, Disease X represents the knowledge that a serious international epidemic could be caused by a pathogen currently unknown to cause human disease. Before you go, "Oh, so it's not an emergency yet," or "WHO is just exaggerating," think back to the beginning of the coronavirus and how it could cause almost 7 million deaths in the world. Apart from many other reasons, it is partly due to most of us having unrealistic optimism. We think it could happen to others, but it definitely will not happen to ourselves. This leads to complacency and will ultimately allow the virus to thrive. If nothing changes, Disease X will likely be no different. While Disease X is shrouded in mystery, the same can be said for other viruses in the world. According to the EcoHealth Alliance, there are 1.67 million unknown viruses on this planet. Scientists currently know of only 263 viruses that can affect people, which means almost nothing is known about 99.96% of potential pandemic threats. How crazy is it that we only know of 0.04% of the viruses that exist with us? The one thing that is known about Disease X is that it is caused by pathogen X, which will likely be even more deadly than the coronavirus. Experts believe that Disease X is zoonotic, which means it originates from wild or domestic animals and then infect humans, just like Ebola, HIV/AIDS, and again, the coronavirus. But before you look at animals or your pets differently, pathogen X may also be a result of mutations in existing pathogens, lab accidents, bioterrorism, or can even be a zombie virus that has been unlocked from the permafrost due to the warming climate. Despite the uncertainties surrounding Disease X, the global scientific community is actively working to stay one step ahead of the virus. However, more needs to be done as medical experts worldwide are asking for more funding to support efforts in monitoring and studying potential pandemic agents. From the most recent pandemic, it is not hard to predict the repercussions of the even deadlier Disease X. With the lack of knowledge surrounding pathogen X, any vaccines or treatments will likely be unavailable. However, by understanding the gravity of this threat, it is possible to work towards proactive strategies to prevent and mitigate consequences. You and I can also contribute to the fight against this unknown Disease X. Apart from raising awareness for this disease and staying informed, we must also lose the unrealistic optimism attitude that we have for such events. Where possible, we can also support ongoing research efforts in any way that we can. The recent coronavirus should have also emphasized the importance of personal hygiene practices and civic-mindedness that we often overlook. Fostering a culture of preparedness and understanding can help ensure that we will be better equipped to face any future health crises. Are you prepared?